Welcome to the Prolific Health and Fitness Podcast. You may notice that each episode, the setup gets a little bit fancier. Eventually, we will be doing these in space. But for now, the upgrade for this episode is these fancy mic stands so that we don't have to hold anything. Peyton is going to be a special guest today because Peyton is actually formally educated in the topic that we're going to discuss today, which is training and recovery from surgeries, particularly of the invasive kind that would affect your joints and muscles and connective tissues. So I'll toss out the first question. Peyton, say I have a boo-boo from an injury. I get surgery on it. What are the general rules, without getting into the specifics of what that injury might be, that you would want to follow to recover from and then train through that surgery?
That is a big question right out of the gate, to
Boom.
be fully honest with you. So honestly, I'm going to have to tell you it depends.
Okay.
So as an occupational therapist,
Mhm.
I work with more upper extremity than I do with lower extremity. Just because usually we give physical therapy the lower extremity and spinal. That's kind of how it works. Except if it's right out of surgery and you're in a hospital setting, then I'll help people with like hip replacements, knee replacements, making sure that they can get their shoes on without breaking, protocol, and whatever the doctor sets for them. But it really, really just depends what the injury is. I can't really give you like a general outlook because it is in a therapeutic mind, I should say, so specific to what the injury was, how long it takes to recover, if it involved a nerve, it involved how invasive was it, kind of thing like that. So I can't, that's a hard question. That's a really hard question right out of the gate.
I get that. Just to clarify a little bit, correct me if I'm wrong, occupational therapists differ from physical therapists mostly because your education involves a lot more integration into actual everyday life when it comes to recovering from injuries or surgeries, as opposed to just heal that tissue and make the pain go away, and then we're good.
Yeah. So physical therapy and occupational therapy are different. Most people come in and actually call me a physical therapist, and I'm like, wait a minute. I am not a physical therapist. So occupational therapy works on those activities of daily living that just take up our everyday life. So if you're used to, putting on your pants a certain way versus another person, okay, I'll ask, how do you put on your pants? Let's see what kind of tools and how I can help you get your pants on.
Tools for putting your pants on?
Yeah, there's tools like little grabbers.
Little grabbers.
A little grabber, a little pincher, yeah.
Okay.
There's things like, a shoe horn to be able to put on your shoe. Like there's different objects that you can use to get on the pants. But that's an example. Or if, you had an injury for any reason on your shoulder, but you want to be able to bench press again. And that's your goal. That is the only thing you want to get it done. All right, let's figure it out. How is your movement pattern? Let's look at those. I still, analyze movement patterns. I still look at the muscle groups, the joint, the injury to it, how severe that injury was, how old you are, all these different things of your health history, and figure out a way I can get you back to bench pressing the way you want to bench press. So really, I look at what your goal is, what you find as an activity of daily living, right? It could be a leisure task, a hobby. Like I said, brushing your teeth, putting on your pants, something like that. And then taking it from there of how we can get you to do that again, kind of thing.
Okay, so let me give you a specific injury then.
Okay.
And
you're really just coming at me, Stan.
You're
the car handle really well.
Let's spread the love.
Sure
Stan, what do you think? Hands. What do you think, Stan?
Yeah, let me toss Stan a question. Stan, what's your favorite number?
7.
All right, awesome. Peyton, back to you.
Good God.
Okay. You're dealing with a wrestler, high school wrestler.
Okay.
During a takedown, they were picked up in the air, and as they were coming back down, they thought it'd be a good idea to stick their arm out towards the ground and try to brace themselves.
Mm-hmm.
Hand hits the ground, elbow goes in the opposite direction the elbow is supposed to go. They dislocate their elbow, hyperextend it fully. Now they're in a not too good spot. How do you, first of all, what, if any, surgeries might be required for that? And then how would you go about formulating you don't have to get into every movement that you might have them do, but what would be the framework of recovering from that surgery and then rebuilding proper mechanics so that they can participate in their sport again?
So, depends.
Okay.
Right. Everything in a therapeutic world really depends on what's going on, how mobile they were before. So if they had some hypermobility before, you asked about surgeries, I can't give you that answer.
Okay.
I'm not a surgeon. Surgeons, orthopedics, they will look at, they'll get an x-ray, an MRI to see what's going on in there, see if there was any bruising on the outside, and kind of go from there. I wouldn't be worried about the elbow because the elbow won't do that as much as you think it will. It's more of the wrist that is going to be the problem. Because if you're coming full out with that hand, you're hitting that wrist pretty hard,
Mm-hmm.
and it's jeering, right? So what that's called is a foosh. So a fall with an outstretched hand, literally boosh.
Boosh.
So a lot of older population actually gets foosh fractures because falling on ice or something like that, and they try to catch themselves. That's what I would be worried about instead of the elbow. The elbow, I mean, like I said, how hypermobile will they be before? How old are they? Are they actually like a freshman? Because are they still growing? Did we just hit a growth plate? Like, these are all the things that are going through my mind. Recovery wise, it really depends on what the orthopedic really sees from everything and kind of finds. Is there, a chip in his radius or ulna? Is the olecranon completely broken? The olecranon is that little pointy part on your elbow.
The tip.
The tip of the elbow, yes. The weenus, as some people call it.
I thought the weenus was the inside.
No, the weenus is
No,
the
you're
outside.
right. Yeah.
The outside is
My bad,
that
my
little
bad.
skin you can pull on.
That's right, yeah.
Yeah.
Unexplainable skin.
Yeah, it really depends on what is found on imaging.
Stan, correct me if I'm wrong. She sounds like me when you guys ask me a question.
Yes.
Yeah.
What do you mean?
So they'll ask me a question, and I will do one of two things. I'll either say, I'm going to need some more specifics, because I'm already thinking like 30 different factors that led up to this, that are involved in this, and that will come into play after this. And then, or the other option is I just don't ask those questions and I just start answering them instead. And so what could have taken 90 seconds to answer, I just end up talking for the whole podcast, and that ends up being the whole episode.
So does this mean we're wrapped up and I'm good to go?
Nah.
I think that it's knowing what I know just from a human and exercise sciences standpoint. I would be really reassured if I was listening to this and trying to determine, like, you see experts in any given practice or field of science on podcasts all the time, and their degree gives them an inherent authority, and so when they talk, people just assume that they know what they're talking about. But as we all know, we all listen to experts say some of the dumbest things you could fathom, even though they have a degree that should have prevented them from ever saying what they just said. But when somebody comes on and you try to ask a question like that, and instead of having a blanket statement answer, you are super concerned with a bunch of the other details because the details do matter. They play a huge role, and you're having trouble answering the question because you are thinking about the 100 different things that you need to screen for, questions that you need to ask, prior injuries and history of performance. And then you're also looking at what is the exact spot that we're trying to get them to.
Yeah.
So, from an outside perspective, as somebody who in the future might look for that kind of uh, medical care, I wish that every practitioner talked like that and answered questions like that, because that demonstrates that you, the fact that you are asking those questions indicates that you would know the answer to those questions. And we've literally had people come in here before who have said that they have this certain pain point and that they went to physical therapy. And I shit you not, we'll be like, okay, cool. What did your physical therapist say the injury was? And they never even did. They never even told them what the injury was.
Yeah.
And they didn't screen them for anything. We have a lady who had a shoulder surgery.
Mhm.
And the only thing that they did for physical therapy is they put her in a machine that took the thing that she just had surgery on and then just stretched the shit out of it.
A machine?
Yeah. That's what she described. She said they didn't do any movement screens on her, no strength screenings, nothing. They were just like, here, sit in this chair, and it manipulated her arm in a way that just yanked on the thing that just got repaired via surgery and retore it.
Love that.
And she was never even, it was never even explained to her, this is what this is supposed to do.
Yeah.
Even if the explanation would have been wrong,
Yeah.
at least that would have demonstrated that these people at least had a thought process as to why they would have this person do that. So
Yeah.
it's just a long-winded way of saying that you may be frustrated that I asked such a broad question,
Yeah.
but I think it's really cool. And Stan, let me know what you think, that you have such difficulty answering such a broad question, because that shows that the level of depth that you go to with each of the people that come to you is pretty insane. And you must take a lot of time to figure out what caused the issue, what is the actual issue, how are we going to fix the issue, and then what are we going to do beyond that to prevent it in the future.
Absolutely. Yeah.
Yeah, I think it shows a difference in the level in which the practitioner cares about the people they're working with, because like you said, a lot of people go on podcasts and they will assert their authority as if they never actually read a book when they were in college, you know, and then they'll go and they'll say all these things because they treated one person and this is the absolute truth. And it's like, time out. Actually look at this person. Most people are built differently. You know, there's a big difference between a 50-year-old man and a 16-year-old boy. You know what I mean? Could be the same injury, but they're most likely going to heal differently. They're probably going to need different standards of care. They're probably going to need different rehabs to go through these things. So I definitely agree. I think it shows. It just shows the level of depth, but it also just shows that the level of care that is there isn't just, okay, I've got 15 people I got to see today. Oh, 3 of them are shoulders. Okay, they're all getting the same thing. Like, it just shows a different level of care in general, like physically, like, you know, maybe touching the patient, but then it shows a different level of care for the actual practice.
Yeah. So with my patients, I spend the most time educating. I go through screens and everything like that, but I'm sitting there, I pull, I'm such a visual learner that I pull up photos and they're like, nobody's ever like showed me a photo of my shoulder injury or like what it is or like my hand injury, right? So I take the time and I sit there and I'm like, this is what happened to you. This is where we're going to go with it. This is probably the amount of time. I can't give you a certainty on that because everybody heals a little bit differently, and take it from there, right? Like, they're like, thank you for showing me a photo. And I'm like, you're welcome. I don't know how you've been learning or how people have been teaching you, but I'm such a visual learner that I need that photo, right? So I just take the time and I'm like, yeah, this is where we're going to go with it. I do have a really difficult time on answering Logan's such broad questions just because it really depends. It depends on so many factors of how you're going to heal, how you're going to take certain exercises and how long it's going to take. So I apologize that I'm not able to answer those, but still, like, I just, it depends. That's going to be my answer for a lot of things.
Sure.
Is it depends. It really depends
So
on
if we give you
anyone.
So if we were to give you like a, for lack of a better term, like more of like a case study type of patient, right? So like we have somebody coming back off of a knee injury because the thing for
Don't
the
give me knees. I don't do knees.
If we have somebody coming off of a torn labrum,
Okay.
and let's say they're 26, played baseball their whole life, and maybe they want to get back into a rec league, but now they know that they need to get back to the gym. There's maybe some atrophy there. Maybe they let the injury sit for too long and didn't do anything for it. Because this podcast is about what to do or what types of things people would do exercise wise post surgery, what would you suggest for someone that maybe have come off that torn labrum, a former baseball player, maybe 26, 27-year-old male, and he just wants to get back into a rec league, and maybe he didn't deal with lifting weights the way he should have when he was playing in college?
So did he ever get it fixed?
No, it's still pretty jacked up. He got surgery on it, but he didn't do all the...
He didn't do therapy really afterwards. You're killing me.
We love you.
Yeah, like if he got surgery after it, my first question is, do you know if it was anterior, posterior, inferior? Right? There's different parts of the cuff that you got to think about.
Okay, so if we're thinking about, say he's a pitcher.
Why
Yeah.
don't we just let her pick an example?
Yeah, pick an example. How you gonna mess up my question with your long-windedness?
Yeah, I mean, like I said, it depends. It really depends on where it was, how long ago it was. If it happened in high school and he's 26 now, he just didn't keep up with his. He might have done therapy.
Happened in college.
Oh, sorry, happened in college. Yeah, and he just didn't keep up with his therapy the entire time, which a lot of people do. The first thing I'm going to look at is the surrounding musculature. Is there something weak? Is something not activating, right? Most of the time it's external rotators. So anything in that group of musculature, like people will get super, super weak in that external rotation because we don't make that motion a ton, right? So that is a huge stability group that people just neglect. So usually I go straight for the external rotators, see how weak they are. Sometimes people are great in the external rotators. If they were a pitcher, sometimes that internal rotation, has just gotten weak since they haven't used it in so long, because you're internal rotating to throw a ball. So I'll look at internal. I'll look at, what their deltoid is doing. I'll look at different movement patterns. Basically, like tons and tons of stretching. I'll look at and stability in that shoulder. Then I'll look at the scapula. What's the scapula doing? That, your little wings. Most of the time people wing out, which is that scapula basically lifting up because your serratus anterior is really, really weak, which are those like muscles. If you see like a really ripped guy and he's got like that rib musculature, that's your serratus anterior, which connects to the scapula. And a lot of people neglect it. The only people who don't neglect it are like boxers most of the time. So I'll look at the scapula, see how that's moving. Like it just depends how everything's moving and where I go from there, right? How strong is everything? What's weak? But the biggest thing is stability to that shoulder. That's what a lot of people lack. So I'll look at the stability in it. If they don't have any, we'll bring in stability. If they're super tight somewhere, we'll stretch that muscle, right? just kind of try to get very, I don't know the words, homeostatic.
So
joint.
what you're talking about is, I know us as a collective training staff have talked about a lot, and something that we are frustrated with in general in the corrective exercise medical treatment world is that there is not nearly enough time spent figuring out and then fixing what caused the injury in the first place. Why did your labrum tear?
Mm-hmm.
And you kind of went past his question of what would you do to the labrum, and you just started talking about fixing what actually caused that labrum to tear in the first place, which was that poor shoulder stability. So that's another layer of that, is beyond helping that soft tissue to heal and recover, but also looking at what are the flaws in the way that you move or your ability to move that caused that deficiency in the first place that culminated in an issue or an injury. So what are some other things that you see in the industry that frustrate you or that you would do differently? So like what occasionally makes you want to slap somebody?
A lot of things.
Slaps.
Like my husband making me get on this podcast is one of those.
Hey. You said you weren't going to talk about that.
You know, I had to bring it up at some point. I'd rather be behind the scenes. Anywho, I mean, a lot of things frustrate me. I think a lot of practitioners, therapists, nurses, they get pissed off about something, because like I can't control all the surgeons. I don't want to control all the surgeons. You know what I mean? Like I don't want to control. That's a lot. I mean, just people not listening to the patient is huge, or the client, member, whatever. Because they will tell you exactly what's wrong, what hurts. And if they're like, my elbow hurts, but you never look at the shoulder, what are you doing? Right?
C's get degrees. Remember that.
Like they focus, so they don't listen to the patient. The patient will tell you exactly what's going on. It hurts whenever I lift my arm above my head to put up the dishes. Okay. So I'll look at that movement pattern. But then, it might be something more than just that front part that's activating. So you got to look at it holistically. You got to look at the whole thing. If your elbow hurts, like, okay, what movement patterns does elbow hurt? But you've had a shoulder replacement in the past. Interesting. Let's look at the shoulder. Is it all in the shoulder? Is it up into the neck? Like, there's so many things that people miss out on is because they don't test it. Granted, we don't have the entire, we don't have 8 hours just to focus on one patient. Unfortunately, we have an hour usually for an evaluation. So even if you can't get all your testing done in that time, just to figure out what the heck is going on, it's okay. Like take your next, the next 45-minute session to an hour session, do some testing at the beginning, see if you can pinpoint it there. Do your research. A lot of people don't do the research afterwards. I am researching and learning all the time from my patients. I can't get out of that sponge kind of mode, because I want to learn. I want to know what is going on for that specific person. That is gross. Don't do that. Because every patient presents so differently that you got to continuously do your research. You got to learn from your patients. A lot of people don't learn from their patients either. I constantly learn from my patients. We had a guy one time, he told us, he wasn't able to walk for 2 months. So what did he do? Him and his wife, and then like his neighbor, they built a rig in their house to be able to like him to set on basically like a little swing so he could get through the house by using like a pulley. He did that. I was like, holy crap.
Yeah,
you know what I'm talking about? Like he was able to get to the bathroom by himself by building this rig that he didn't have to like apply for through his insurance kind of thing. So one, I guess, not listening to your patients. 2, not researching enough. 3, not looking holistically at the patient. 4, what did I say? Did I even get to 4?
Not knowing how to build swings in your house.
Well, I wouldn't know how to do
Imagination.
that, so I don't take that upon anybody.
Not researching.
I said that one.
Oh.
That was number 2. Anywho, yeah, I'll give you 3.
Okay.
Let's go to you guys. What
Sure.
do you guys think about, members who come in and they're like, I've had, back problems for so long that nobody's been able to fix it. I've been to physical therapy. I don't have a bulge disc, but it hurts whenever I squat. Like, you guys run into that issue all the time with so many people here that they tell you physical therapy or therapy didn't work. Help, right?
Yeah. Stan says all the time that I have 3 facial expressions, and the third one doesn't come out very often. But the second one it's this. It's
You do that a lot.
that's the facial expression that I make when anybody tells me that they went to see any professional other than the 1 or 2 that I've personally worked with and can verify the quality of, because every single time somebody tells me about their experience with pretty much anybody in the fitness industry, aside from a very select few, my opinion of the average goes down because nobody is always a student anymore, which I think is the most important thing. Nobody is humble enough to say, I don't know. Like, I came to you with my shoulder issues and you did some shit and you were like, honestly, I don't know. Let me do some reading and come back to you. And then the next day you were like, hey, here's what I think it is. Let me do some other shit to you. And you did, and it worked. And you're like, cool, we learned something.
Mm-hmm.
So when people come in and I have them do like a basic test of, I don't know, external hip rotation, they're like, oh, my PT never had me do this. I'm like, are you seriously? Why? This has to be like step 1, looking at stuff. But shameless plug, I think it helps a lot if you, as a therapist, have a staff of corrective exercise trained trainers that you can then send your patients out to continue the work with, so that you do not have to pay $100 a session 6 times a week.
Forever.
I just bring that up because you said you don't have 8 hours with your patients, but if you're a prolific member, then you do have 8 hours with your rehab technicians, which are us.
Hi.
So come to Prolific. I think that the gist of what we've talked about is basically that people don't do enough to care for the patients. They don't do enough to continue their own education. They don't do enough to treat the cause of the issue. And they don't do enough to prevent the issue from recurring again in the future. So, unless you have anything you want to add, then I'll wrap it up. Okay, I thought of a really inappropriate joke earlier.
Oh boy.
And it's taken me several minutes to think of a less inappropriate version. So here it is. Basically, what Peyton was saying earlier with the external rotation is that you need to be able to execute a strong pimp slap. And so if you're sitting at home and you're watching this and you're wondering, could I pimp slap with some effectiveness? If the answer is no, then you need to work on the external rotation. If the answer is yes, then it sounds like you're in the minority of people.
Sure.
So,
And that part was not the inappropriate part of the joke.
that was like a 1, and what I thought of was a 10.
Oh boy.
So I had to keep dialing it down.
I think a 1 is a hitchhiker thumb, right? You're hitchhiking is a little bit better than
Help a brother
hip
out.
slap.
No, because that's not
You know?
inappropriate.
I was going
It's still a
G
level of
version
inappropriate.
for any children who might be watching.
What child is going to click on this?
I don't know.
Hey, listen.
Got to bring in that G
Okay.
version.
I click on this video is not made for kids every time when I post
Oh, well.
our podcasts. So,
And then you click on it every time.
anyways, that was Prolific Health and Fitness Podcast, where we had Peyton come on and basically explain to us why the standard of care is lower than it should be, and why if you have a boo-boo, you need to see someone who asks a lot of questions and then teaches you a lot. And if they're not asking a lot of questions and teaching you a lot afterwards, then they're not doing a very good job. So if you find yourself in that situation, look for a different therapist. Also, Peyton lifts. And if your therapist does not lift, you need a different therapist.
I have one question.
It.
Kids question of the day for you, Peyton.
Kids question?
That's right.
Oh, boy.
Coming from Left Thumb out of Washington. He says, what's worse, a boo-boo or an owie?
Obviously, an
Pretty
ouchie
sure-
is worse than both of those, but
I'm pretty sure a boo-boo is worse than an owie, right?
I feel like a boo-boo has visual indicators. An owie could just be subjective.
This is also
They're both
true.
technically subjective.
I feel like
So a
I
boo-boo
don't think there's
requires
an
a Band-Aid.
objective of either of those. I
At
think
least.
both get a Band-Aid at some point, but boo-boos, I don't know
Does
where
an
the fuck
owie
I'm going
become
with
a
this.
boo-boo?
you just said the F word, so now this can't go on
Sorry,
YouTube
children.
for kids.
And G version out of it.
All right, thank you for listening. If you have any questions about the stuff that we just talked about, then you should post them in the comments, and then maybe we can get Peyton to scroll through them and answer them, or get you to come in here and ask them in person. Thank you for listening, and we will catch you on the next one, where we will have assistants holding the microphones for us.